treatment, 2 can be the placebo. Yes. So that 100 number will be divided into 50-50 of two groups. One will receive the test group and one will receive the placebo or the standard treatment. Yes. So that 50 people who will receive the standard treatment and that 50 who will receive the placebo will be decided on the basis of randomization. That it will be done by random selection. It's not like it's like we have a system. On this system we enter patient's detail. Yes, after entering the patient detail, the system automatically by itself will assign few numbers, like suppose group 1 2 3 4 number will be like group number 1 will be given group 2, number 2 will be given group 1. Yeah, it's like random. No one can decide which patient will be going into which group. Yeah. Okay.
Yes, ma'am.
Yes.
Yes, ma'am.
If you don't understand, kindly help me to say yes or no, or tell me. I'll just explain it again. Yes. Please feel free, feel comfortable. If anything, I'm okay. Yeah.
Yes, ma'am.
Yes, sir.
Try
Yes,
to
ma'am.
understand. That is more important. If you want me to explain 10 times, I'll just explain you, but just let me know if you know or you don't understand. Yes? Understood? Okay. Then what are the factors you need to consider for selecting a clinical trial design? So when you are designing a clinical trial, so what are the things that you need to consider in your before doing a clinical trials, before preparing a design? It's like the study population and indication. So what kind of population you need? Suppose we are doing a diabetes study. So the indication is diabetes. So the study population that we will be taking will be obviously diabetic patients. Yes. Then we'll see the treatment duration, how long the treatment duration will be. Some studies take 1 year, some takes 2 years, some takes 3 years. So we need to see how long the treatment duration will be. Cost and logistics. This is very important. If you're doing a clinical research, it's very important to do the costing. How much money you need to spend where, you should know beforehand. Yeah, you can't spend the money like when you're doing the clinical research, you need to go out for something, visiting patients or going for lab testing, or for n number of visits you need to go to the other centers. So for everything you need to have the money for it. Yeah, so you need to add the costing for everything. So the costing is very important. Then patient convenience. Suppose we have a trial for 1 year and the patient need to visit the hospital every 2 months. Yeah. So we'll check whether the patient is convenient to visit every 2 months for a year time. Or if the patient is not convenient, sometimes it's like the patient withdraw from the study. The reason is because they are not convenient to visit the center again and again, and there are n number of follow-ups. So we need to consider this also, the age population that we are considering. If the patient is old age, he's not willing to come very often. Yeah, so you can extend the visit, you can reduce the visit. It's like if you are having a visit for every 2 months, you can reduce it to every 3 months or every 4 months. It's like, so you can reduce. So you need to check the patient convenience also. It's not like you are just thinking about your research that you need to get data. You need to check the convenience of the patients also. And you're also considering the statistical consideration is also very important. Then we are coming to the types of clinical trials. As we have already discussed that in what is an observational study. Can you just tell me in one word what is an observational study? Just told you. Anyone?
I mean,
No drug study.
Yeah. And this we are just doing the observation. The terms itself tell you the observational study is just we are doing the observation. We are not doing any procedure, no treatment, no device use or no intervention. Yes. On the basis of observation, we do the follow-ups with the patient and check the outcome of the patient. In observational study also there are two types of study. One is cohort study and the other is case control study. In a cohort study is also known as a prospective study or a future study. In this, we predict the future on the basis of risk factor. Yeah, suppose a person is is smoking. Yes. So in future, what can happen with the smoking? Can anyone tell you?
Lung cancer.
Yeah, very good. So this study tells you about we try to define the risk ratio. We try to find out with this the risk factor what will be the outcome. So suppose we have a population of 100 people and out of 160 people smokes and 40 people are non-smokers. So the study is for 10 years or you can say for the 5 years. In the 5 years duration, we have follow up with the patients. And after 5 years, we get the data that the smokers, it's like the 60 people who were smoking. Out of 60 people, 40 people developed lung cancer. Yes, and 20 people doesn't develop lung cancer. And in the other groups, the non-smoker group of 40 people, we get the data that out of 40 people, 3 people develops lung cancer and 37 develops no cancer. So on this databases, we do the risk ratio evaluation. We'll come to know from this how many patients will be in future having the lung cancer and what will be the ratio of this risk factor smoking to the lung cancer. Then the second type of study is case control study. Case control study is also known as retrospective study, which cohort studies prospective means future. We predict the future. In cohort study, we go to the past. It's like you can say a person comes to you, she's having a cancer, or you can say she's having a breast cancer and you are going to find out the risk factor why she had this breast cancer. So you divided the study in the same way in the group. Then you see that this do you have any idea why we have breast cancer? The one cause of breast cancer is oral contraceptive pills. If we take a lot of contraceptive pills, it can cause breast cancer. So if a patient comes with a breast cancer, we'll try to analyze what she has taken in the past, which can cause her the symptoms. So this is mainly on the basis of question and answer study. On question and answer basis, we collect the data and we come to the outcome. This is just the observational type of study. We are not doing we are not giving any treatment, we are not giving any drug, it's just by the observation. And in an interventional study, we do the comparison. Yeah, in interventional study, the subject is given a test drug. One group will be getting a test drug. That test drug will be compared with no treatment or standard treatment. So we have a test drug so in the study it's mainly like we do the comparison of the active drug with the placebo or with the no treatment. Yes, clear? No? Okay. So the investigational study is a study in which we do the comparison. Yeah, we have a standard drug. We have this test drug. This test drug is being compared with no treatment. This test drug is being compared with the placebo, or this test drug is compared with the standard treatment. We are going to do the comparison between the test drug and the placebo or the standard treatment. And we'll see whether our test drug is better, superior, inferior, or equivalent to the placebo or to the standard treatment that is available. Do you understand?
Yes, sir.
Yes, ma'am.
Yes, ma'am.
So It's a comparison which is being done with our test drug and placebo. It's a comparison between the test drug and the placebo. So we'll check whether our test drug is more efficient or is more useful with the standard treatment or no treatment. Then we have the trial design. Trial design, there are several types of trial design. One is non-randomized controlled trial. I told you what is non-randomized. Then we have randomized control trial. This also I told you what is randomized control trial. In randomized control trials, there are n number of these designs that are known as parallel crossover. This will go into detail later. Then we have single or double blind. Then we have superiority or non-inferiority trials. So non-randomization control trials. Participants are allocated into treatment and control group by the investigator. That we have discussed earlier, that in non-randomization, it's the investigator who will decide that which group, whether the treatment group or the control group, who will take with medication. Yeah, this is being decided by the investigator. It's not in the hands of, it's not randomly assigned. So when you see the control, control used in non-randomized, what are the controls? So when you see the concurrent controls are the controls where the participants match according to the demographic, where we see the exact control group is what? The control group and this treatment group, there's just a one difference, that in control group does not receive any active test drug, and this and the treatment group receive the active. This is a just different. Other than that, everything is same, like demographic, like the age of the patient, sex of the patient, and ethnicity of the patient, marital stage. This all these things should be same, and it comes under demographic. Then comes the historical control. Historical control, what do you understand by that? Is like the participant received the medicine being studied. Yeah, the results are either compared. Like one group is getting the test drug, and what to say, control group is the group who had received the standard care in the previous period. It's like 1 year ago, this diabetic patient went for a standard treatment, took the medication, and after 1 year, we find that this patient is suitable for our study. We can take this as a control group. So that type of patient is took under control group. It is known as historical control. The participant who received the standard treatment in the previous period, that comes under control group, and that participant is being compared with the test drug group. Then comes the randomization and clinical trial. Randomization means it's like assigning the process by chance. It's like one is getting test drug, one will be getting placebo. This is not decided by the investigator. This is done by the randomization process, by the system, where randomly you can get either the test drug or the placebo. This is completely, and this randomization, it's like every participant who is taking the part in the research has the equal chance of getting the test drug. There's no biasing. It's like in non-randomization investigator can be a bias. We can say that this is my known one, I can give this patient a test drug, and the other one we can give you placebo. And this randomization, you cannot do this. It's a system generated, or you can do different techniques are there for doing the randomization. Okay. So the main objective of having this randomization was to minimize the selection bias. So there's no biasing, because in the non-randomization, the investigator can be biased to his known ones in providing the treatments, or yeah. So in randomization,